So I am getting ready for my mammogram 2 days after my mom was given the great news that she is now breast cancer free and officially a survivor. It was important for me to share this journey with you because before my mom was diagnosed, I used to blow off my mammograms, and then when my mom was diagnosed, it changed my world.
The good news is I had my mammogram 2 weeks ago and my scans were just fine, and I hope all of you are getting your mammograms as well. The key to early detection, of course, is awareness and screenings like 2D and 3D mammograms. Unfortunately, they are not always easily accessible to everyone, especially women of color, Black and Hispanic in lower income areas. In fact, Black women are more likely to die from breast cancer than any other race or ethnicity. And that is our focus today as we continue to highlight Breast Cancer Awareness Month as we try to answer that question, are we winning the battle? Joining me right now, Dr. Natalie Williams, surgical oncologist and director of surgery residency program at Howard University College of Medicine and Howard University Hospital. That's a mouthful, but thank you so much for being here, Dr. Wilson. And also Natalie Williams, survivor and the founder of the Natalie Williams Breast Care Foundation. Natalie, thank you for being here. Dr. Williams, I want to start with you. The statistics to me, when I started reading over the literature, were just staggering. I mean, I couldn't believe it. First off, DC has the highest rate of breast cancer in the nation. Breast cancer is the leading cause of death for Hispanic and Latino women. And then that fact I just read, Black women are more likely to die from breast cancer than women from any other race or ethnicity. Why is that?
You know, it's a complex question. It's a great question. But there are things that we know and there are things that we don't know. The important things to know about that is that there are cancers that grow faster and grow larger, that women of color oftentimes present with diagnosis that's later stage, that there are gaps in access to care, gaps in time of diagnosis to intervention, and there's also some biologic and genetic aspect as well. So all of those things I think play a role along with risk factors.
Let's talk about what are some of the risk factors then. Is there a difference when you look at communities or ethnicities? What are the risk factors, Dr. Wilson?
We do. There are risk factors that are family risk factors. There are reproductive risk factors, for instance. What the age that you had your first child, the age that you had your first period, when you went to menopause, the lifelong exposure to estrogen. So some of those are risk factors. And then there are risk factors that we can control, such as alcohol, physical activity, sedentary lifestyle, and things like hormonal replacement therapy.
All right, Natalie, I'm going to switch over to you for a second. You're a survivor, diagnosed 2 years ago.
Yes.
You went through a double mastectomy, chemo, radiation. You're here, you're clean today. And last year you decided to develop the Natalie Williams Breast Care Foundation. And I know one of your primary focuses is women of color.
Yes.
Tell me about that. Why?
So we realized that through my experience that the messaging just was not where it needed to have been. And so while we applaud all of the other much larger foundations for doing the work that they have done, and certainly they do a lot around research and helping women live through this disease, I thought it was very important that we develop a foundation that speaks directly to women of color, whether it's Black or Hispanic, Latinos. But that's important because I believe the messaging should be very different. I believe the outreach should be different. And in order for us to reach them and encourage them to actually take that step to have a mammogram, we're going to have to say the right things at the right time in the right places.
Absolutely. Dr. Wilson, let me go back to you for a second. I forgot to mention you are also a survivor.
I am.
Congratulations to you, diagnosed a year ago.
Yes.
We talked about some of the differences or why we saw some of the stunning statistics that I mentioned at the very beginning. You mentioned, could it be a lack of resources, a lack of awareness in certain communities that, you know, they just don't know about? And if so, does Howard offer programs where people can find those resources?
Well, I'm glad you asked that because we absolutely do. There is a program that we provide for women. It's actually done every month of the year on the first Saturday of the month. It's called the Rosemary Williams Mammo Day Program. It provides a clinical breast exam by a oncology or cancer expert and also digital mammogram on the same day.
So how does someone get signed up for that if they're watching right now?
If they call our patient navigation service, I can give the number.
Sure, go for it.
It's 202-865-4655.
Okay.
And she can schedule you in, and you can go to our website at cancer.edu.
We'll put all the information on our website. And Natalie, quickly, I know you guys offer a lot of resources and things
We do.
for women. Give us your website and information on how women can find more information about the Natalie Williams Breast Care
Our
Foundation.
website is www.supportbreastcare.org.
All right, we put the information up on the screen for you. Thank you, ladies, both for coming in. I have so many questions, but our segments go so fast. Bottom line is early detection and screening.
Get tested.
Early screen.
All right,
Yes,
thank you so much for coming in.
absolutely.
All right, thank you.